If you suffer from nearsightedness, farsightedness, or an astigmatism, and you don't want to wear glasses or contacts, LASIK surgery is an option, but it's not for everyone, and the most important thing to do is to do your homework. For more than a decade, people from all over the country have been flying right here to Jacksonville to meet with our next guest to discuss LASIK options. And Dr. Gulani is an eye surgeon, and he joins us today to talk about the Gulani difference. Thank you so much, Dr. Gulani. We appreciate you being here. And it is true that people fly from all over the globe to come to get your perspective and to get your advice on LASIK surgery. And we hear so many stories coming from your office. And just happened to the next to you over there, we have a story about a pilot who was so enthralled with what you did for him. He wrote you a letter and he actually flew a flag in your honor over in Afghanistan.
To me, Casey, this is why I say what I do, it's a privilege and it's priceless how patients respond to my work, and I have no words for this. This was a pilot with very high astigmatism. He's in the Army and he actually flew this flag in our honor and sent us a certificate. I had no words. I was speechless when this came to us by mail.
Yeah, that is their livelihood. I mean, for pilots, they have to be able to see, and they have to be able to see very well. Otherwise, they're grounded. So I've heard that you are really against the cookie cutter approach and the routine outcomes. Kind of elaborate on that a little.
I'm not against anything, Casey. I'm just strict with my principles, which is if you consider every case, every patient to be unique, then there is no case that is routine. That's what I'm trying to say, teach, and explain all the time. To me, it's a top priority to me to greet the patients myself, be fully involved in their care, and also personally be available for follow-up. I think patients' times are as important or more important than my time. Why not give them the best we can? So if you look at any scenario of how we are uniquely tailoring surgery to each patient, it's like you can get a suit based on your height and waist in a mall, and that's okay. But what if someone really measured you down to the ankle, selected the material and the design to fit you? There's a difference.
Oh, it's a huge difference. When you put it that way, it makes perfect sense. But when I think of LASIK surgery, and I think a lot of people out there think the same, or cataract surgery, you think one size fits all. You either get LASIKs or you don't get LASIKs. But there's more to it than that.
Absolutely. There's a full range of LASIK laser vision techniques, a whole range of cataract surgeries and different technologies. And again, if you think about it, Casey, it's like you can get a burger through a drive-thru and that's lunch. Yeah. And then you can have a chef that knows every ingredient and can perfect a recipe tailored to your taste, need, and health. There's a difference. So when you're talking LASIK, it's actually one among 18 laser vision techniques that can be designed for you. There is no need to have a cookie cutter technique unless it's individualized to your own benefit.
Yeah, and I think a lot of people don't realize that it's all about the personal touch, and each individual patient is just being so key and tailoring it to them. What if I'm told, though, I'm so dead set on getting LASIKs, and what if I'm told I'm not a candidate?
So again, if you're told you're not a candidate, maybe for LASIK, but then there are other modified laser techniques that can be done for you. For example, the most common reason people are told they're not candidates for LASIK is they have a thin cornea, meaning not enough tissue to shape. You can do a technique of laser where you don't cut or chop or use any blades, and by doing that, you're saving tissue and still correcting you out of glasses. And once again, it comes back to that same concept. You know, when you ask for only one surgery, or if the surgeon knows only one surgery, guess what you're getting?
Yeah, you're getting that thing. Exactly.
Instead, it should be tailored to Casey, and it should be in your best interest, and then the surgeon should be able to perform the complete range of procedures.
You make it sound very simple, and I'm sure for you it's not, but I'm sure when you're explaining it to the patient, it makes them feel at ease.
It is so simple. It is, Casey. I mean, when I talk to patients, they get it, because if you explain to them, each patient is unique, your eye is unique, your visual status is unique. You could be nearsighted, farsighted, astigmatism, after 40 reading glasses, cataracts. All of this can be corrected as long as you're healthy, and even combination techniques can be used to bring you to the best vision.
So I don't know if a lot of people know this about you, that you're an inventor, you're an author, international teacher of eye surgeries. You are known as the Da Vinci of eye surgery. I don't know where you find the time to even show up on this show, but I mean, just to talk a little bit about, you know, your passions. And I think when I say inventor, you need to elaborate on that a little bit more. When what have you invented?
My quest is to take vision to beyond 2020, to make it safe and reproducible for every patient. I've invented instruments used for LASIK surgery, cataract surgery, diagnostic technologies, and more importantly, as you asked for me, when it's a passion to do something, Casey, you don't look at time. It's fun for me waking up, going to my institute, receiving patients from all over the globe, and doing the best I can.
Yeah, well, when it's a passion, I'm sure it does not feel like work. So, and I've heard people say that you could be anywhere, California, you could be up in New York City, but you've chosen Jacksonville as your home. Why Jacksonville?
You know, I get this question every day, Casey, so I finally came up with a one-line answer. I ran out of gas.
So you just wound up here.
That's right. But actually, I was invited from New York to start the department for UF and Shands for LASIK, and I believe Jacksonville has great potential to become a medical center for the country at this point.
Well, we're very
Yes.
fortunate to have you here, Dr. Gulani.
My
Thank you
pleasure
so
to be
much
here,
for
Casey.
sharing your perspective and insight with us.
Thank
We really
you.
appreciate it. We want to thank the Gulani Vision Institute for sponsoring this segment. And for more information to schedule an appointment, you can go to their website, which is gulanivision.com, or you can call them at 904-296-EYES.